At a Senate hearing on youth mental health needs, practitioners, educators, and students testified on the importance of destigmatizing mental health and increasing access to health care. Witnesses also called for the training of school staff and students to better detect early signs of mental illness. This hearing is just over an hour and a half.
Medical student education and psychiatry at Tulane University School of Medicine. She received her Bachelor's of Science at Loyola University in New Orleans and a Master of Public Health at Tulane. Attended medical school at Lake Erie College of Osteopathic Medicine in Florida. Returned to New Orleans to do a residency in psychiatry and subspecialty fellowship in child and adolescent psychiatry at Tulane. After developing expertise in caring for the young person's mental health during her medical training, Dr. Weiss built the first comprehensive episode psychosis care program in New Orleans called Epic NOLA. She also launched CALM, which is a community education campaign to increase people in Louisiana's awareness about emerging psychosis symptoms and available treatment. In my medical practice, I worked in the same setting as Dr. Weiss, taking care of the uninsured and the chronically mentally ill. They would have, I tell you, benefited from your expertise, Dr. Weiss. So I'm grateful that you are here, and we look forward to hearing how your experience and your education can improve the support for our youth. Mr. Casey.
Thank you, Ranking Member Cassidy. Dr. Wright, thanks very much for your testimony. Dr. Weiss.
Thank you for having me here, Chairman Casey and Ranking Member Dr. Cassidy and the rest of the committee. Again, my name is Ashley Weiss. I'm a child and adolescent psychiatrist at Tulane School of Medicine in New Orleans, Louisiana. I specialize in first episode psychosis. Psychosis is a symptom typically associated with the onset of schizophrenia and bipolar disorder. These illnesses can have devastating consequences, from the increased risk of cardiovascular disease and premature death to the ramifications of being chronically marginalized by society. Why am I bringing up illnesses like schizophrenia and hearing about mental health in high school and college students? It's because this is where they start, in our young people, and not by any fault of their own. Adolescence is a time of incredible brain maturation, and for some, this maturing process goes awry, leading to the emergence of severe psychiatric disorders. These illnesses don't discriminate. They were present pre-COVID, and they're still present now with a little bit of a different context. And globally, these illnesses lead to the greatest cost, both directly and indirectly. So what is psychosis? Psychosis can be described as a loss of touch with reality. Examples of psychosis symptoms are hallucinations, confusion, and delusions. These experiences start small, like mishearing sounds as voices, or beginning to feel as if people are watching you. This paranoid feeling could turn into a belief, a delusion, where one is convinced the world is literally out to get them. And it is difficult but very necessary to imagine what this might feel like for a young person. Some facts about psychosis. 3 out of 100 people will experience psychosis in their lifetimes, mostly occurring for the first time between ages 16 and 25. For every one person experiencing psychosis, 6 other friends or family are directly impacted. In the U.S., the average time one experiences psychosis prior to treatment is 72 weeks. Not days, weeks. 1 in 10 will attempt or complete suicide, with the highest risk being after the first episode. So to give these statistics a local context, George Washington University enrollment is about 26,000 students, which means almost 800 will experience psychosis annually and will not receive appropriate care for over a year. Over 4,500 friends and family are impacted. Nearly 80 will attempt or complete suicide. So there is a sense of urgency because time is not on our side. The impact of the brain can be deteriorating. The last 3 decades of research show that specialized intervention as early as possible after psychosis onset improves outcomes across the board. There is no time to wait. The same philosophy is already accepted in stroke intervention and should be accepted in psychosis intervention as well. In 2015, I started the Early Psychosis Intervention Clinic in New Orleans. We've treated nearly 1,000 people since we opened our doors. Our multidisciplinary team provides coordinated specialty care, including medication management from psychiatrists, individual, family, and group therapy, and wellness coaching. All treatment is deeply individualized with the goal of getting young people back on track, and that often means back to school or graduating or to their first job. But what we do in the clinic is not enough. Because of the need for early treatment in psychosis, we're forced to think about early detection. We have a robust early detection campaign called CALM, which was mentioned, and this aims to educate the community about psychosis, debunk myths, reduce stigma, so hopefully people will feel comfortable and safe coming forward for treatment. Our goal is that an individual comes forth on their own, and they don't have to wait for someone else to bring them in, and they certainly don't have to wait for the police to pick them up having an acute psychosis and take them to the emergency room. There are significant challenges and barriers that must be considered. For most people, recovery can take many, many months, but time continues to pass for everyone else in their lives. Their friends have often moved on, graduated, moved away to college, or started their first job. They often feel misunderstood, ashamed, quickly leading to the loss of confidence and increased isolation. And there is a conspicuous gap in school-based recognition of these needs for these individuals in keeping them engaged or even welcoming them back after their recovery. I have multiple college students in my program, students in every college in Louisiana, actually, which makes me very proud, who didn't even know that they were eligible for retroactive medical leave that would erase incompletes from their transcripts, who have crushing student loan debt from the semesters that they became ill. And we are often the first place to provide guidance on how to approach these issues. There are financial threats to programs like ours. Although our program is committed to long-term care, most programs like ours don't go beyond 2 to 3 years. We are now realizing that people lose their gains when they lose specialized care, but how do we pay for continued care? We've subsidized our growth through the congressional legislation mandating a portion of the SAMHSA block grant be set aside for early severe mental illness. We appreciate this opportunity because it covers the necessary care that is not covered by insurances. In our state of Louisiana, Medicaid and commercial insurers do not reimburse any of the coordination of care that's required to provide this model. No case management, no record review, no coordination with community partners like schools or hospitals, no treatment team meetings. And without the coordination, the risk of relapse increases exponentially. If commercially insured, patients might have 2 copays a week. That will quickly add up after a month, and that becomes unattainable. People in this age group fall off their parents' insurances and then might not even qualify for Medicaid. And then barriers exist beyond our clinic. There's a pervasive lack of education coupled with ample misinformation about psychosis and what it even is. This gap in education exists in the general public, but extends even to mental health professionals. Psychosis is not a topic in health education curriculums for high school or college students, even though their age group is most at risk. Psychosis education is not a prominent part of the curriculum for those interfacing with high-risk groups. Psychosis intervention is far from being considered an essential part.
Doctor, we have to wrap up.
Okay. Can I have a 10-second wrap up?
Sure.
Okay. I'm here today to say out loud for the record that our youth and young adults are the vulnerable ones to these illnesses, and we cannot ignore this fact as a society any longer. These illnesses are not curable, but they should not be associated with an inevitable lack of productivity and institutionalization. They're not preventable, but there are strategies to mitigate risks, such as early detection. They're manageable, but management does not mean doing the bare minimum. That approach has not served us well historically, and we need to do better for our people. It's a necessity for them. We must be ambitious in our commitment to these youth and young adults, so that their recovery is supported while they explore their opportunities that they deserve and expand their futures.
Doctor, thanks very much. We'll conclude now with Brooklyn.